My name is Dr. Milli Barthakur. I'm one of the consultant clinical oncologists working at Musgrove Park Hospital in Taunton. 2 million people are living with or beyond cancer in the UK. Fewer people are dying from their cancer, but the incidence is estimated to rise by 3% a year. The National Cancer Survivorship Initiative was set up to take forward the development of services needed by survivors of cancer. As a result of this, there have been several health and wellbeing clinics that have been piloted which have had very positive results. The aim of these clinics is to provide comprehensive and holistic support to a select group of patients to enable them and their carers to lead as normal a life as possible following their cancer diagnosis and treatment. Transferring the follow-up care for selected patients will be done within the context of a multidisciplinary team, which will include consultants and cancer nurse specialists. Those patients selected will be the ones that fall into the low-risk category who would otherwise require annual follow-up only. The aim is that these patients would be able to return to a normal life quickly with a whole host of support. If the patient's or carer's needs are not met at one of these clinics, there will be support available to point them in the right direction where needs more appropriate to themselves can be met. For example, a local support group. Evidence suggests that many recurrences are self-detected rather than being picked up at a routine follow-up appointment, so patients will be taught to be self-aware and hopefully will also learn from each other. Patients will be advised about signs and symptoms to be aware of that may suggest a recurrence of their cancer. If there are any concerns about this, patients should have the reassurance that they will have the appropriate contact numbers, usually through their cancer nurse specialist, to allow direct access back into the hospital system. The focus of these clinics will be on recovery, health and well-being after cancer treatment. Quite often, after an intensive diagnostic and treatment course, patients can feel quite vulnerable when this pathway comes to an end. In many cases, particularly for the low-risk group, further follow-up may be infrequent, and it's often been noted that patients have got several questions that may not be able to be fully addressed at the end of a treatment clinic appointment. And this may be due to time constraints and also due to the lack of availability of the relevant discipline at the time of the clinic appointment. The hope is that the wellbeing clinics will solve these issues. These health and wellbeing clinics will reduce pressure on very busy hospital outpatient clinics, with a huge potential to reduce the number of unnecessary hospital appointments for those patients with a very low risk of their cancer coming back. Patients whose needs can be managed in a non-clinical environment will avoid unnecessary visits to the hospital and all the associated inconveniences, such as long journey time, parking and waiting. As an example, within 12 months, just over 300 patients who had just post-operative radiotherapy to the breast were seen in a hospital oncology clinic. Transferring the care of these patients to a wellbeing clinic will potentially create over 300 hospital clinic appointments in the breast outpatient per year. These appointments can then be used to see patients who've got more complex medical needs, as well as those patients who have been seen in one of the health and wellbeing clinic and have found to require more clinical input, to which they can have direct access back into. These clinics are one-stop shops which are run for a group of patients, providing a range of support rather than one-to-one traditional clinic appointments. They last longer, usually a 2-hour morning or afternoon session, compared to a 15-minute hospital appointment. The clinics are site-specific, so visitors will have the chance to meet and share thoughts with people who are in a similar situation, and this may be through support groups or through a buddying up service. Patients who are making the shift from cancer diagnosis and treatment to life after cancer can talk to a broad range of individuals, including clinicians, cancer nurse specialists, and other allied healthcare professionals. Clinics can be used to find out all the facts about issues such as benefits and other financial support. They can also find out information about how to get back to work, good diet, and lifestyle. They can also find out about possible long-term side effects of treatment and issues surrounding their particular cancer, and about local services and facilities available to them. There'll be regular presentations which are relevant to a particular tumour site, and the website will be regularly updated with current news and information. Education will be key in the successful running of the clinics, empowering and involving the patient in their decision-making and recovery. The appointment at the Health and Wellbeing Clinic will be replacing the final hospital appointment and effectively will be the discharge appointment. The aim is that once the patient and carer attends one of these clinics, they'll be well equipped and well informed to carry on and live life as normally as possible.